is working, but we're live. It's 10:30 Pacific Standard Time, and it is a Sunday. And the reason I wanted to just do a live really quick with you guys is because I did not post a YouTube video this week, just like I usually do every Sunday. I haven't even talked to my team about this, but I'm like, gosh, I need to just get on here and just connect with you guys and just see what questions or comments you have, because I didn't post a video today. So I just wanted to make myself available and see if anybody is on here. So there's a live chat I think that I can turn on. So if you guys have any questions at all, now's the time to ask. And the reason why I post videos every week for you guys is so I could like answer questions and respond to comments that you guys have and talk about topics that you guys are asking me about. And because I didn't post a video this week, just because it's summer and things are really busy with like the kids and, end of year summer activities and traveling and people visiting, I wasn't able to get a video out to you, but I wanted to answer any questions that you guys have and respond to comments, because that's the whole reason why I do these videos. So my last video was on supplements that I just had started, and I think you guys hopefully enjoyed that, and it was enlightening for me too, to kind of like keep up to date with the different trends in medical, in medicine and medicine as a subspecialty in longevity specifically. So I started a lot of new supplements, and you guys had a lot of amazing questions and comments about that video. So thank you so much for watching. And if you have any other comments or questions on just, I don't know, lifestyle activities, workouts, eating habits, what I eat in a day, and how I, just manage being a mom and, being a doctor and running my businesses and stuff, because it really is hard. It's hard to balance everything. And that's why, something sometimes has to give. If you're with your family or with your significant other, or taking care of yourself or your loved ones or work or career, it's hard to like fit a YouTube video in each week. And so I feel like I dropped the ball with that. So I wanted to like make it up to you by doing this random and spontaneous live. So for those of you who are on, thank you so much for joining. And I'm gonna try to get to as many of these questions as possible, but I have a pretty short amount of time. Hi guys, you're so sweet for your sweet comments. Thank you so much. Somebody asked if I recommended Silpherm X. I think I don't have anything negative to say about it. I, as well as a lot of my colleagues at our academic meetings, when we meet in forums in our dermatologic academy meetings, have not been very, overwhelmed. We're a little underwhelmed with the results for that device. So I personally don't have that in my office, but I've heard good things, and I don't think it can actually hurt you. So, if any of you guys have had a great response to Silpherm and have something good to say about it, amazing. But I haven't been too impressed, but everything's relative, right? So in my office, we have really high powered lasers and really intense devices that require like an upscale level of training to operate. But, that may not be accessible or available to, people in med spas or mid levels or so forth. But that doesn't mean that they're not good. It just means that, they just require a lower, skill set level, so they're more readily available. But when you have access to stronger devices, the people who actually know how to use these devices, sometimes it's a better outcome. So I don't really have anything good or bad to say about Silpherm X, but if you guys want to share your experiences, that would be helpful too. Somebody asked, what's the worst that could happen with Kybella under the chin? So Kybella, for those of you who don't know, is called deoxycholic acid. It's an injectable fat dissolving solution, and it is usually intended for treatment of the submental fullness, aka the double chin. It works really well, but sometimes under the chin is a little bit more stubborn with respect to the adipose or fat there in its resistance to treatment. So usually it takes about 2 to 3 treatments, spaced about 4 to 6 weeks apart for best results, but it does really, really well. There's maybe like a small percentage of like 10% of people who don't respond that well to Kybella, but once you up the dose, if you did 1 vial, you do 2. If you did 2 vials, you do 3. Then usually with the subsequent treatment, people do pretty well, but some people are recalcitrant, and what that means in medicine is just not responsive to the treatment. And so there has been documented cases of Kybella not really working for under the chin. And for those people, usually you want to go with, maybe liposuction or something of that nature. But in my office, we have a lot of success with Kybella under the chin. I did it, I think, in my early 40s, and was really happy with it. But Kybella is really great for melting stubborn areas of fat that are on the body where your body likes to hold on to it, like the backs of the arms, like the lower abdomen, medial thighs, sometimes like above the knees, like random places where you get fat. It works really well for like melting fat in those stubborn areas. For those of you who are fit and you're lean and you eat clean and you diet and you exercise, but there's that stupid stubborn annoying area of fat, Kybella is like the best for that. Somebody asked, let's see. Oh, I bought Orgain protein after that video. I love it. I love it too. So Orgain is just a protein plant-based smoothie that I drink after my workouts in the morning. You know, I try to work out every morning, Monday through Friday, and then it's sometimes hard to get my protein in. And these plant-based smoothies by Orgain, they're like in a little box. It's really easy. I actually dump 5 grams of my creatine, which I use Thorne creatine, in that, and I just shake it up and just drink it before going to the office, because it's hard to get your protein in, you know, when you're like working, but then you don't want your workouts not to count. So those Orgain smoothies have been a godsend too. So I'm glad that you guys experienced that too. And again, I'm not sponsored and not affiliated with any company or anything. So I just really just recommend things that I know work and use myself, and that's why I recommended it. I want you to be part of my glow up. You're so sweet. I'd be happy to. I love glowing up people all day long. And of course, you guys should see all my MDA products. I never deviate from these, you guys. I just ran out of my vitamin CFK, and I had to go to my sample pack to use my vitamin CFK. And this Body Tight, if you haven't used this for the summer months, I'm flying through this, because this helps tighten skin on especially like the skin on your inner arms, your abdomen, your thighs, your legs. It's like amazing. So if you guys haven't tried Body Tight, that'd be part of your glow up too. And I'm obsessed. I don't use anything else either. And it's just, when I deviate from these products, it's just not good. My skin is not happy. So somebody asked, I added 100 milligrams of B1 because of you. Now my blood work came with vitamin deficiency. So I always say, like, for supplements, you guys, get your labs checked, because everyone's lab profile is totally different. So you want to treat not only like, you know, symptoms or by age, but you have to see what your labs are. I get my labs checked like every 6 months, sometimes even more frequently. And you have to just see what you're deficient in. Like, for some reason, my body can't take up vitamin B12 through the GI tract. So I have to take sublingual or injectable B12. And that's just my body. I wouldn't recommend that for everyone else, but know your labs and know what you're deficient in, or what you genetically may be predisposed to in the upcoming 20, 30, 40 years, and just kind of like attack that. So what works for me may not work for you guys, and vice versa. So I think it's really, really important to, you know, be mindful of that. Somebody asked if I take HRT. So I'm actually on the birth control pill. I was going to show it to you guys. I'm on the birth control pill. I get regular periods. I'm 48 years old, and I still get regular periods. And I actually went to see my doctor recently, seeing if I could get off the birth control pill and maybe think about HRT. And she's like, absolutely not. You're going to get pregnant. You're high risk for pregnancy because you're the age that you think you can't get pregnant. And that's when things happen. I have 2 beautiful kids, a son and a daughter, a teenager now. And, we're good. So I need to be careful of that, but no, I'm not. I'm still on my birth control pill, but you know, we'll take that in time, and you know, keep taking me off the pill, test my labs, and when the time comes, I'll definitely do like full on HRT. But for right now, I guess I don't need it, but I'm open to it when the time comes. Is it possible to remove a scar after breast enlargement fully with laser? So yes, absolutely. There's different lasers that address different morphological components of a scar, whether it's texture irregularity, like a keloidal kind of hypertrophic plaque, hyperpigmentation, redness, hypopigmentation. So I have every laser, well, not every laser, but all the best lasers in my office, because each different type of category of laser just excels and just gives the best results. And I have that through each category, like for every type of morphological scar treatment in my office. So yes, we definitely can. I wouldn't say erase. Erase is a big word. To erase a scar is a big deal and a big promise. I don't want to overpromise and under-deliver, but usually we can make scars look a lot better, especially for breast augmentation and breast reconstruction for sure. Okay, somebody said, so thank you for sharing your wisdom. It's my pleasure. Thank you for hanging out with me. This is me making it up to you that I don't have a video up today. Things just got so busy with the kids, and oh my gosh, my daughter just finished junior lifeguards, and she like placed 4th, which was amazing for her because she's young for her level. And it's called the Iron Child, which is like a triathlon, and she just did amazingly well. So I didn't have time to film with the office and patients and everything. I just haven't had a chance to post a video. So this is when I don't post a video on Sundays, I'll do this for you guys. So I could at least be available to you for like office hours. So let's see. I love the spontaneous lives. Yeah, my 2020 lives. I used to do that all the time. It was so fun. Somebody asked me about the sunscreen coming out. So the sunscreen was supposed to launch earlier this month, but I'm so like type A and just want it perfect, and just want to test it and retest it, make sure that it's perfect, that it's not quite ready yet, but hopefully at the end of the month. I've been using it. My friends and family have been using it with great, results and great feedback. I use it on my kids. My kids are little beach babies. We live on the beach. They surf and skimboard all day long. We reapply, and it's been really, really great. So I'm excited to launch that hopefully soon, hopefully at the end of this month or at the end of the summer. Somebody asked me about SoftWave. So SoftWave, for those of you who don't know, is an energy-based device to tighten skin. I know it's getting, I don't know what celebrities behind it, but he or she probably doesn't even do it. That's just how the world works these days with affiliates and marketing. SoftWave, I've used it before. Head-to-head comparison with Thermage and some of the other tightening devices is very underwhelming, which is why I don't have it in my office. Usually it hurts. It usually requires more than one treatment, and patients aren't usually happy with the results. So my favorite tightening device that's energy-based, meaning it uses radio frequency as a form of energy to stimulate collagen and tighten skin, is Thermage. For those of you guys who know, I love Thermage. When you do it right and by the book and you follow protocol, which most med spas don't do, they're buying old refurbished machines to discount their overhead or decrease their overhead. They're using one tip among multiple people. When you do it by the book, the right way, like Stephanie, my amazing laser nurse specialist in my office does, it just knocks it out of the park. There's no comparison. So SoftWave, I think it's okay, but compared to the other ones available, I wouldn't waste your time or money. Plus, you usually need more than one treatment, and it's hurt, and it's painful, and it's expensive. I wouldn't dare let anyone else to provide laser and aesthetic treatments on my skin. Smart, definitely smart. It's the Wild West out there. You should see some of the complications and lawsuits that happen with people who aren't laser trained and fellowship trained in lasers, doing just things as simple as like hair removal and like scarring people. So just be really, really careful out there. Do you love it? I'm like in my robe. I literally was like getting ready and I'm like, I'm just gonna hop on here and talk to my fam, have office hours. Somebody says, what if the under the chin segmental issue is just skin, no fat? Okay, so this I think is going back to the Kybella question. So the patient who asked about Kybella for melting under the chin fat or adipose tissue or the double chin, if you do have fat or too much laxity in that skin, that's usually not an ideal treatment, because fat's like volume. When you decrease fat, you can have more laxity here. So it's a patient by patient, case by case basis. When people see me in my office as a patient, I do an assessment and I feel like the fullness of the adipose right here, but I also want to check the skin trigger and the elastic recoil of the skin. And if they don't meet the criteria, like if I feel like if we melt fat, it's going to cause laxity, either we don't do it or we go with a different modality, or we'll do Kybella with like Ellacor, which is microcoring to tighten skin, or Kybella with Thermage, or different options too. Sometimes I'll refer to plastic surgery, but a lot of people are trying to avoid surgery and I don't blame them. Somebody said I look flawless. That's so sweet, because I literally I have not gotten ready yet and I'm just in my robe in my bathroom, just without any lighting or anything. So I appreciate that. That means a lot to me, you guys, especially since I'm getting so beat up by my kids. I have a teenage boy at home, and yeah, I'm not feeling really pretty right now, but thank you so much. Okay, can you go on HRT if you have melasma? I know you previously said you have melasma. I definitely do have melasma. I have active melasma, so I have to fight it every day. I use my vitamin CFK. I use my sunscreen. I use HelioCare. I'm really diligent about it. Again, I live on the beach. I'm on the beach every day with my kids, and I love hot yoga. I work out every day. Even when I do like Pilates and Legris, I get sweaty, or if I wear a headband, it can make the melasma activated, because melasma is not just from sun, it's from heat, it's from hormones, it's from a lot of different things. But yes, you can absolutely go on HRT. You just have to stabilize your melanocytes. Remember, the melanocytes are the pigment producing cells that are in overdrive in those patches of melasma. So if you can suppress their production of melanin safely and effectively with like vitamin C, kojic acid, or whatever active ingredient works for you, even if it's a short dose of hydroquinone, or if you want to hit it with a laser, that's even better, then you definitely, can still be on HRT. Don't not do HRT and have the health benefits of HRT because of the possible risk of melasma, because we can control melasma. It's definitely, it takes work, obviously, but we definitely can control it. So somebody said, I get a combination of 532 nanometer and 1064. I love when you talk wavelengths and parameters and lasers, guys. Okay, 1064 laser treatment for rosacea, but came across a paper on the genotoxic effects on skin fibroblasts of these lasers. What are your thoughts? Absolutely not true. Fear mongering, not based on science or scientific data, randomized controlled trials, and evidence-based medicine, because this goes against the American Board of Dermatology, the American Academy of Dermatology, and the didactic residency lecture series that we get from the ACGME. So I don't know where you got that information, but I'm here to squash it. Not true. 532 nanometer wavelength is coherent with hemoglobin as the chromophore on the photo. You know, on the spectrum where you're looking like at physics and wavelengths and what it is binding to, fibroblasts are way down in the papillary and reticular dermis, are not going to be affected by it. 1064 nanometer wavelength laser is more targeting, you know, melanin as a chromophore. I think it may targets other things, but fibroblast, that's just throwing a bunch of science. It's like, say I'm fluent in French and somebody knows a little bit of French and they like speak, they're like kind of pretend French, and I'm like, I speak the language. I know, I see right through it. But as someone who doesn't speak any French at all, it's going to sound like the person knows what they're talking about. So I'm here to squash that data. Don't worry about that. That's absolutely false information. Do you feel like Botox doesn't work that effectively anymore, shorter lasting and not fully freezing your face anymore? I actually do Daxify now just because I just like doing it twice a year. I don't want to have to do my Botox every 3 months. But I never got tachyphylaxis, which in medicine means like resistant to it. I do think there's some patients who are more sensitive to certain neuromodulators than others. It may kick in faster. It may last a longer duration. It may lack some side effects that you may get with other neuromodulators. Like sometimes people will get a transient headache with Botox, or they can get flu-like symptoms from Botox. Again, this is like less than 2%, but I feel like there's a different neuromodulator for each individual phenotype. So for people who want a very clean, pure neuromodulator, Xeomin is great. If you want a longer lasting, look, I don't have time to do this all the time, neuromodulator like Daxify, like that's what I do. I just do it twice a year. If you want Botox, which is kind of like the tried and true most studied pharmacologic agent in the US, you know, I say go with Botox. But if you're maybe building resistance to it, or it's not, you know, taking effect as long, usually that's not like a response from your body having like some immunologic resistance to it. It's usually because maybe you're going to an office that's watering it down. You have to be careful of that. If they're having $8 a unit, they're getting $8 a unit from something. They're usually watering it down, and that's why it doesn't last or it migrates. And that's why when they inject it up here, you get too heavy, because the more water you put in the Botox, the more the office can save money on their overhead. But the more watered down it is, and it migrates into areas that you don't want to treat. I see it all the time. So in my office, we're by the book, and usually our results last about 3 months. For people who are more active, maybe they have a higher metabolism, they'll burn through it a little bit faster, and it'll be like 2.5 months. But still, for all intents and purposes, people do really well with Botox. But if you want to come in less frequently and you want like a little bit longer lasting, you know, blockade, then you use Daxify, and that's what I do. Okay, I'm gonna have to wrap it up here soon, guys, but I just wanted to, you need a UK distributor for skincare brand that your overseas customers can avoid paying expensive import fees. I know, I have a whole team that's trying to kind of get around the whole logistics for international shipping. And A, it changes like every month, and B, there's a lot of hurdles in our way. So if anyone has any recommendations for that, that would be amazing. But yeah, these products, you guys, if you are not using these products, you are definitely missing out, because when I deviate from these, and trust me, I have access to everything. My skin definitely shows it. And even like with the body type, when I put on my body type, my arm skin, everything is just so tight, and it's just like, what did I do before I had this? So I hope everybody has access to it. For people to not have access to it, it makes me sad. Also, most of the, like back, if you guys have been following me since like 2020 or 2019, a lot of those skincare lines that were like top level that I really backed up and like would promote to my patients, like have changed their ingredients. They got bought out by bigger companies. The active ingredients are totally different. And I knew this because I wholesaled them. So the company would have to send a letter saying, yeah, about that, we changed our formulation. So just be wary of that, because some, you know, ones that were the greatest before aren't as great anymore. Somebody said, I love your products. I ran out of ECM eye serum and my raccoon eyes came right back. Yeah, so the ECM eye serum, whereas it has a little vasoconstrictive activity in it. So it has green tea polyphenols. It has caffeine, niacinamide, polypodium leucotomas, different active ingredients that vasoconstrict and brighten up the under eyes. So you don't have like that ruddiness like under the eyes, and it also brightens and tightens the under eyes. So I'm obsessed with it, and I'm glad you guys are too. Hi guys. Oh, I had to order more vitamin C, eye cream, and NMF hydrator. I totally get it. I do too. I love that. Thank you so much for the feedback. Um, Somebody said, is all therapy the best option for lower face? Not in my opinion, you guys. Remember, there's a lot of marketing and celebrities backing it up, but real doctors, honestly, we don't do that on ourselves. Like, we have access to everything, and none of my colleagues are just reaching out for an old therapy that I know who are actually truly using it behind closed doors. I really think Thermage is probably the best. Again, I'm not in any affiliation with the company. I've done it myself 4 times. I did it on my 30th birthday, 35th, 40th, and 45th, and I really think it's helped, especially with the lower face and the under eyes. I'm like obsessed with it. But you have to find a provider that has, for the under eyes, a special under eye handpiece, a tip that goes under the eyes, and then also who knows how to put in eye shields, because that's really, really important. So if people say, oh, we don't treat the under eyes, it's usually because they don't either have the tip or they don't have the training and skill set to put in an intraocular eye shield to protect the eye. So one more question, you guys. Let's see. Okay, let's see. I'm gonna try to get a good one. Let me see. Somebody asked, what do you think about Sculptra mixed with PRF in the temples and mid-face? I think that would be fine. I'm a big fan of PRF. I like the Easy Gel form of PRF. For you guys who don't know, PRF is just platelet-rich fibrin. It's basically a blood product that we take from your own blood. We spin it down, and we get the growth factors, the stem cells, and proteins in the blood that have rejuvenating effects. It works really well, especially for under eyes, especially for people who want to avoid filler. It's a great filler alternative. Mixing it with Sculptra, I think, would be fine, especially in the mid-face. I'm not a huge proponent of Sculptra in the temples. In my education and training, this is very high risk for blindness. I usually use Voluma, which is the only FDA approved hyaluronic acid based filler for temples. It does really, really well. For those injectors watching me, you have to go down to the periosteum, retract, make sure you're not on bone, and it's a highly advanced injection technique to inject the Voluma there. But when you do it there, it's very safe, it's very effective, and Sculptra is very high risk for blindness. There's a lot of arteries there. People go too superficial, and if you were to have an occlusion, you can't reverse it. So I wouldn't go to anybody who does Sculptra in the temples. That's a telltale sign they're not board certified in dermatology or plastic surgery, and probably shouldn't be injecting people there because it's very high risk. If what you know, and what you don't know, you don't know. And sometimes when I see injectors are so cavalier, I'm like, if they had any idea that they could easily blind this person, they probably wouldn't be this laxed about it, this cavalier about it, and not making a reel on Instagram about it. Because those of us who are board certified and lecture and teach are just like cringing. So anyway, okay, I don't want to end on a negative note. Let's do a positive note. Okay, are lasers okay for people with vitiligo to use? Absolutely yes. However, you have to proceed with caution. With any dermatologic condition, you have to understand the pathophysiology of the disease and get the appropriate laser settings, and parameters accordingly. For example, vitiligo is when people have patches, white patches of depigmented skin because the melanocytes are undergoing immunologic attack from the immune system and they stop producing melanin. So you get these white patches. So there's a phenomenon in dermatology called Koebnerization, Koebnerization. Sorry, my brain works really fast. But Koebnerization is when you have trauma to the skin and it induces a cascade that perpetuates the disease progression. So if you have like psoriasis and you fall and you hit your elbow, you'll get a psoriatic plaque there. So it's that kind of phenomenon that happens. So with lasers can be seen as trauma to the skin. So if you have vitiligo, I always think it's good to do a test spot to test and make sure that you're not going to get a vitiligo patch in the area, like maybe do an area offsite. If you do treat, I just actually did an erbium laser on somebody who had vitiligo, but she already had vitiligo around her perioral area. She had really severe etched in lines there. And she's like, I don't have pigment here anyway. And now all you see is just wrinkles and texture. So I'd rather just go, risk benefit analysis and go with erbium. And we did it and she looks phenomenal. I literally erased etched in lines in a woman in her 60s who had never taken care of her skin from the Midwest, found me on YouTube, flew in to see me. And we literally made her around the mouth area look like a 20-year-old. And to be able to do that with a laser, I mean, that laser is very powerful and you have to really know what you're doing and very, proceed with caution. But she had vitiligo and we treated her. But there's lasers that actually help treat vitiligo. They can help repigmentation of that skin to help decrease the immune response attack on the melanocytes to allow them to naturally produce melanin and repigment the areas that have been, depigmented previously. So I hope that makes sense. I hear myself talking. Sometimes I talk to you guys like residents and med students, but I think you guys are all smarties. And hopefully you can look up or chat GPT stuff, but just be careful with that if you don't understand some of the terminology that I'm using. But I love you guys. As always, thank you for hanging out with me. I'm going to get you a video next week up. We're going to do one on kind of just like an overall on vitamin C and vitamin C serums and melasma and hyperpigmentation because it's summertime. And I know a lot of you guys have questions and comments about that. So stay tuned. That'll be next week's video. As always, I love you guys. Drop a comment in the comment section. And if I didn't get to you today in this live, I'll be sure to check my messages and my comments by the end of the day today. Tomorrow's Monday when work starts. Sometimes it's a little bit harder to do that, but I'll be checking them periodically throughout the day, and definitely when I get my kids in bed tonight and when I have a quiet moment to myself where I can connect with you guys. All right, love you guys. Thank you so much for your support.